Welcome to Rareza Health, your ultimate health and wellness guide. Subscribe for easy-to-follow health guides, motivation, and expert insights to transform your health. Imagine facing constant lung infections, difficulty breathing, and digestive issues every single day. This is the reality for those living with cystic fibrosis, a genetic disorder that primarily affects the lungs and digestive system. But what exactly is cystic fibrosis? What causes it, and how can it be managed? In today's video, we'll break down everything you need to know about this chronic condition, including its causes, risks, symptoms, and the latest treatment options. 1. What is cystic fibrosis? Cystic fibrosis, or CF, is a genetic disorder that affects the cells responsible for producing mucus, sweat, and digestive fluids. In people with CF, these secretions become thick and sticky, clogging airways and leading to severe lung infections. This condition is progressive, meaning it worsens over time, but with the right treatment, individuals can lead longer, healthier lives. CF is caused by mutations in the CFTR gene, which affects the movement of salt and water in and out of cells. This leads to the production of thick mucus in the lungs and digestive system, making it difficult to breathe and absorb nutrients properly. 2. Causes of cystic fibrosis. The primary cause of cystic fibrosis is a mutation in the CFTR, cystic fibrosis transmembrane conductance regulator, gene. This gene is responsible for regulating salt and fluid balance in various organs. When it's faulty, it leads to the production of thick mucus. How is CF inherited? Cystic fibrosis is an inherited condition, meaning a person must inherit 2 defective CFTR genes, one from each parent, to develop the disease. If a person inherits only one faulty gene, they become a carrier, but do not have symptoms. If both parents are carriers, there's a 25% chance their child will have CF. 3. Risk factors for cystic fibrosis. While CF is a genetic condition, certain factors can increase the risk of inheriting it. Family history, having parents or siblings with CF increases the risk. Ethnicity, CF is most common in people of Northern European descent but can occur in any ethnicity. Carrier status, people who carry one mutated CFTR gene may pass it to their children without knowing. Genetic testing can help determine carrier status. 4. Signs and symptoms of cystic fibrosis. Cystic fibrosis symptoms can vary in severity, but common signs include persistent cough with thick mucus, frequent respiratory infections and difficulty clearing mucus from the lungs. Shortness of breath and wheezing, blocked airways make breathing harder. Frequent lung infections, such as pneumonia and bronchitis. Poor weight gain and growth, despite a good appetite. Digestive issues prevent proper nutrient absorption. Salty tasting skin, high salt levels in sweat are a key sign of CF. Digestive issues, including frequent greasy stools, constipation, and bloating due to the pancreas not producing enough digestive enzymes. Some individuals experience mild symptoms, while others have severe lung and digestive complications. Early diagnosis is crucial for better management. 5. How is cystic fibrosis diagnosed? Cystic fibrosis is usually diagnosed through a combination of tests, including newborn screening, a simple blood test performed at birth to check for CF markers. Sweat test, the gold standard for diagnosing CF, measuring the salt content in sweat. High salt levels indicate CF. Genetic testing identifies CFTR gene mutations to confirm the diagnosis. Lung function tests assess how well the lungs are working. 6. Treatment and management of cystic fibrosis. While there is no cure for cystic fibrosis, advances in treatment have greatly improved life expectancy and quality of life. Here's how CF is managed. A. Airway clearance techniques. Chest physiotherapy helps loosen and remove mucus from the lungs. Nebulizers and inhalers deliver medications that help open airways and reduce mucus buildup. B. Medications for CF, mucus thinning drugs, such as Dornase alpha, pulmozyme, to reduce mucus thickness. Antibiotics, to treat and prevent lung infections. Bronchodilators, help keep airways open and improve breathing. CFTR modulators, target the defective CFTR protein to improve lung function. Nutritional support. People with CF often struggle to absorb nutrients, so they need high-calorie, high-fat diets to maintain weight and energy. Pancreatic enzyme supplements help digest food properly. Vitamins A, D, E, K supplements, since CF affects fat absorption. Lung transplant, for severe cases. For individuals with severe lung damage, a lung transplant may be the only option to improve survival and quality of life. 7. Living with cystic fibrosis. Hope and future treatments. With advances in research and treatment, many people with CF are living longer, healthier lives. Newer medications, gene therapy, and ongoing research offer hope for an eventual cure. Scientists are exploring gene editing, stem cell therapy, and advanced CFTR modulators to correct the underlying genetic defect in CF. Managing cystic fibrosis for a healthier life. Cystic fibrosis is a lifelong condition, but with the right treatment, support, and medical advances, individuals with CF can lead fulfilling lives. If you or a loved one has CF, stay informed, follow your treatment plan, and never lose hope. Science is making progress, and the future looks brighter than ever. Like, share and subscribe for more health insights.